Hi, my name is Jeanelle Austin, and I'm running for Minnesota State Senate in District 62. And I want to talk about health and healthcare. This is something that has come up on the campaign trail on multiple occasions because people are very concerned about their health. From youth, I have heard that a huge aspect for them is mental health and ensuring that they have the resources to be able to care for their mental health and wellness. I have heard from our people within our queer community the importance of trans health and ensuring that they get all the tools and the resources that they need to be able to live and thrive, especially because Minnesota has declared itself to be a refuge state. And if you're going to be a refuge state, you have to make sure that you extend the hospitality that is necessary for people to live and people to thrive. That people are not living in a hostile environment for their well-being. I have heard from Black elders the importance of being able to access healthcare that is not just about going to the doctor and being pumped with medications from pharmaceuticals, but be able to have holistic care and ensure that they are able to eat the foods that are healthy and necessary to help them actually be well and be whole, and they can get advice in those areas. I think there's a lot of fear as well when people had loved ones who have died because of different reactions to different medications and people feeling like they're being experimented on through the medical system and that pharmaceuticals are making money off of them and their loved ones dying. So we have to make sure that we're actually taking care of people who are on the margins and not experimenting with people who are on the margins. I think when we look at the data in Minnesota, people feeling hesitant to actually go to the doctor because they don't know how they're going to be treated, or they've had past experiences where they felt like that they have not been heard and that the care that they feel that is best for themselves and their body has not been taken into consideration. And we need to do better. We need to be able to uplift the health of children, uplift the health of those who are navigating a disability. We need to be able to uplift the health of those who are our elders and seniors and have different health needs and care, and how are we making sure that we are not marginalizing people. Actually, while I was door knocking yesterday, I heard someone tell the story about that they know someone who recently died because their care was mishandled. And I think that we need to make sure that when we're talking about health care for all, we're not just talking about the economics side of it, but we're also talking about culturally appropriate, gender affirming, culturally sensitive, religious affirming care, recognizing that we live in a diverse, pluralistic society, and everyone should be able to be honored when they go to seek out their wellness and their health. One of the things that we've talked about in George Floyd Square for the last 6 years as well, it's also within the 24 demands, is having integrative health and wellness resources. Western medicine has its benefits, but it doesn't know everything. So what does it look like for our health insurance to be able to cover the issues and the types of care that we feel are best covered by other forms of medicine, by other forms of addressing health and wellness? How do we allow people to choose who they want to go to and allow their insurance to cover that? So the conversation around health and healthcare is not only important, but there's depth to it and there's breadth to it. And I want to be sure that the way in which we are fighting for the healthcare needs within our community, that we're fighting for all of us, that we're fighting for the least of us, that we're fighting for the marginalized of us, that everyone can see themselves in the vision for an improved healthcare system. Because we deserve to be well, we deserve to be safe, We deserve to not have to experience the isms of sexism and racism when we are going to get the health care that we need. I hope that creates some sense of understanding in terms of the vision that we are holding, that we are carrying in this campaign for health and healthcare. We care about all of us, and we want no one to be left in the margins for being well and thriving. So, thanks for listening, and I hope that you join us in this journey because the fight's not over.